Do you know the early signs of Alzheimer's?
Coming up on the Fox 5 Morning News, we'll show you what to look for and also how to test yourself.
Something's not right. You or a loved one, you just keep repeating things, you're forgetting things, you're getting irritated really easily. These could be symptoms of just stress or growing older, or maybe something more serious like Alzheimer's disease. So here with us this morning to help us out to be able to tell the difference is Dr. Jack Schim. Good morning, doctor.
Hi, good morning.
Good morning.
Thanks for having me here.
Thank you for being here. It's a pleasure having you. So we're going to do two things during this interview. Dr. Schim is going to talk about signs and symptoms and prevention and all that, but he's also going to, during the interview, administer a memory test kind of unbeknownst to me, and then we're going to, at the end, we're going to find out where I am on all that. So first of all, let's start out. What is Alzheimer's disease?
Alzheimer's is a very serious neurodegenerative disorder. It's the most common cause of dementia and leads to pretty much an ongoing, inexorable decline in memory, function, thinking, behavior.
And it's fatal.
It's ultimately fatal.
It is fatal. Okay, so what are the signs and symptoms? How do you know that you're leading up to Alzheimer's or dementia and not just forgetting where to put your keys?
Well, it's challenging because, you know, all of us as we age have a certain decline in memory, and life and everything frequently gets in the way and makes it challenging. Stress, hormones, everything. The keys are changes in memory such that they start interfering with day-to-day activity, changes in behavior, you know, someone's just not acting themselves, personality change, someone's unusually irritable.
Because inside, they realize they're forgetting things and they're frustrated because is it because they're realizing that they're having memory issues and that's why they're irritable?
That can certainly be part of it.
Okay. Let's, the clock?
Absolutely. So there are a number of things that we do as physicians. If a patient or their family comes to us and says, we're concerned about someone with changes in memory, there's a website that's very useful. It's called youcanbetheone.com. It gives a lot of screening information. But one-on-one, when a patient comes in to see us, we give a series of questions and tests. So first thing I'd like to do is I'm going to give you something to remember. Then we're going to kind of continue on with some testing. I'm going to give you three things.
All right. And I can't write them down, right?
Nope. You're supposed to remember it. I'm supposed to remember to ask you.
Okay.
All right. So I'm going to have you repeat them. Palm tree. We're here in San Diego, right?
Palm tree.
Green apple.
Green apple.
Pink Cadillac.
Pink Cadillac. Okay.
Those are mine. I use those because I remembered them.
Okay. All right.
So I want you to remember those.
Got it.
I'm going to ask you to do something for me. Can you draw a clock face? Draw a circle about so.
And this is what you do for your patients that come in. This is diagnosis.
This is part of the test, exactly.
Part of the diagnosis. Okay, just draw a clock.
Just draw the face of a clock, a big circle.
Okay.
Now put the numbers in the proper places.
Okay.
And now I'd like you to put the hands on it and let it say 8:15. Okay. So people who have cognitive problems and difficulty with visual processing and mental processing will have a variety of different kinds of abnormalities on that. They might, for example, crowd all of the numbers to one side.
Oh, really?
So that's a useful screening tool. If you think someone's having problems, say, draw a clock and bring that into the doctor.
Really?
Yeah.
So just drawing a clock, something, you know, you'll see the patient will have the numbers on one side clumped or something along those lines. This is something. What are some other symptoms that you'll see in this particular demonstration?
Well, they may have difficulty putting the numbers in the proper places. They may have difficulty assigning the hands. They might write 8:15 across the top instead of putting the hands. In other words, trouble understanding the question.
Wow. Okay. So when do you know that? What is the red flag for when you know there's a problem?
Well,
and can you prevent? Is it in the genes? I'm sorry, I just overloaded you with questions. First of all, let me back up. Is it in the genes?
It's a risk factor. People who have a family history, especially a family history of Alzheimer's at a young age, carry a pretty significant risk of developing Alzheimer's themselves. So if your parent got Alzheimer's at age 50, you have a substantial risk. If your parent got Alzheimer's at 80, that's not such a big risk. It's a common problem. At age 90, about half of people have a dementia.
Really?
Most have Alzheimer's.
Can you prevent it?
There are things that we can do. First of all, it's funny we were following the conversation about prevention and treatment in animals because a lot of the same things pertain. Physical activity, exercise, mental activity, good nutrition all bear on lowering the risk of dementia and especially of Alzheimer's. Management of high blood pressure, for one thing.
Is there a cure in sight?
Well, I wish I could say yeah. There's a lot of research going on. Right now, early identification is helpful because we can treat people with medications that slow the disorder. We can keep them at home with their family.
Early prevention is key. So don't be afraid to ask your grandparents or your parents the clock questions. Don't be afraid to put it on the table, because early detection is paramount.
It's very important.
Okay, so if you'd like to talk to Dr. Schim, you can go to fox5sandiego.com and we'll get you linked up with your group.
Absolutely.
And you can ask him more questions.
We're here at Scripps.
Okay,
and
right
so
here
we're
up in Encinitas.
right up in Encinitas. So I just remembered to ask you something.
Okay.
Which is I had asked you to memorize some things.
Right.
Do you remember them?
Ready. Palm tree, green apple, and pink Cadillac. Oh, dang.
Perfect.
Okay. I thought we're going to send it back over to you now.
I do have a quick question, because you said something, Dr. Schim, about if you manage your blood pressure, that could help prevent or ward off Alzheimer's?
Yes, absolutely.
Really?
There's evidence that management of vascular risk factors, blood pressure being the most important one that carries a risk of stroke, managing cholesterol, diet, medications if necessary, not smoking, physical activity, all reduce the risk of Alzheimer's.
That's good to know. Thank you very much, Christy and Dr. Schim.